Hi guys, so what we're going to talk about today is a day in my life as a psychiatric nurse practitioner. And my goal is for you to have a little glimpse of what it looks like, for you to understand how to organize your day and what to expect. What are the things that are important, it's specifically when you're doing a follow-up on a patient. I break it down between two things, which is what is it that you need to know and what is it that you need to do. So those two things are really important, and there's categories under that that might help you in structuring your follow-up visits with a patient. So if that's something that you like, please stay tuned and subscribe to this channel so you can get more information about being a psychiatric nurse practitioner. Okay, so what is it like a day in the life of a psychiatric nurse practitioner like me? So I work, my schedule 8 to 5, so it's a regular business hours, and it's a community clinics. And first thing I do as soon as I get in the door is to log in because everything is in the computer right now. So the hospital or the organization I work for uses Epic. So I log in on two things. One is the Epic or the healthcare, the EHR that they use. And the other one is also the emails that they have, because you want to know what's going on in the organization. Colleagues also send you emails about certain patients. So those are the two things that I do first. So next, once I'm logged in into Epic, then I look at the list of patients that I see for the day. And usually I have like 2 initial evaluation, and then the rest are follow-up patient, meaning these patients that I have seen in the past and have done initial evaluation in the past and now are just coming in for follow-ups. In my clinic, initial evaluations are 1 hour long, while follow-ups are 30 minutes long. So I see patients between 8 to 5 p.m. and my maximum initial evaluation per day is 2. Depends on where you work. Some people's maximum can be higher. It also depends on their pay structure. So people's maximum daily patient visits is 16 per day. I don't think that I'm capable of doing that at this point in where I am. I do want a balance and not stress myself. So my usual maximum is, to fill out that 8 hour time frame, and it's about 10 to 12 patients a day, including initial evaluations. So my evaluations are usually 1 in the morning for an hour and then 1 in the afternoon for another hour. So the next thing I do is, once I look at my day, how many evaluations that I have and how many follow-ups I have, is review the charts. Usually I have like a 30-minute window where I can review the chart in the morning. If this is a new evaluation, check their history, check the reason for the referral. I also check for their current medical history, current, past psychiatric history if we have that. So I also read the chart of current patients that are coming in for follow-ups. Sometimes because you have so many patients, you may not remember exactly what kind of treatment plan you have incorporated for that patient. That's just normal. So it's definitely okay. That's why we chart, to go back to the past history, the recent chart visit, as to what was implemented, what was the treatment plan at that time, so that you know what you're going to be following up on this time. And I want to talk about, follow-ups and what is it that is important when you're doing your follow-up visits. I broke it down into two things. One is, what is it that you want to know during the time that you're visiting with a patient, and what is it that you need to do during that. And there are 4 things that you want to know. And let's start with, you want to know what the symptoms are now, because when you did your initial evaluation, you have made a diagnosis, and based on the symptoms that the patient has talked to you about, and then you came up with a treatment. What the symptoms are now? Has it gotten better? Is it the same? Is it worse? And you want it to be a measurable behavior, right? Is there less panic attacks? Is it less intense, less frequency? I usually do ask measurable questions like, if you were to rate your depression from 1 to 10, 10 being the worst, how bad has it been on average in the past 2 weeks? You can also use other measures like the PHQ-9 or the GAD-7 so that you can measure at every visit whether there has been any changes in their symptoms. Number 2, what has been the response to treatment? So if you have started a patient, say, on an antidepressant, you want to know if they actually started the medication, right? You want to know if they stopped it. Are they taking it every day? Are they taking just half a tablet? Or they take it every other day? You want to know their adherence to the treatment. And also important is you want to know if there are any side effects that they are noticing. And those are really important information for you so that you can come up with a treatment plan, later on moving forward after this visit. Number 3, you want to know the risks, right? You're assessing for suicide risk. You're assessing for homicidal risk. You're assessing if they are gravely disabled because of their inability to function related to their symptoms. So when you are doing your follow-up visits, you're also assessing all of this risk every single time. And the 4th one is then you're going to have to come up with a treatment plan. Where do you go from here? Based on what the patient told you, the symptoms that he or she is still having or they are still having, the response to treatment that they are talking about now, and the risk, you want to come up with an overview of where this patient is in terms of their condition. And you're going to have to think about, are you going to have to increase the medication? Are they tolerating the medication, that it's safe to increase the medication, or are they not tolerating it, that it may need to be decreased? Or are they having some side effects that are intolerable, that is impairing their ability to function more than before the medication? So maybe that's a time to say, hey, let's stop it, it's not worth it, right? Of course, it depends on the medication and how severe the side effects are. So those are the things that you want to think about while you're talking to the patient during your 30-minute visit. Aside from medication, of course, you also think about the therapeutic strategies that you're implementing, therapy support that they might need, psychosocial challenges that they may need a referral to social work for home support or things like that. Other strategies, exercises, meditation, any supplements that they're taking that may be beneficial to them. So those are the things that you want to come up during your treatment plan that you're thinking about while you're talking to the patient. Okay, so towards the end of the day, the other things I do is refill requests. So I check refill requests, I grant it, I approve it or not approve it. It just depends on a lot of other factors. I catch up on my notes. I respond to emails directly from patients. Patients can directly email us if they are connected to their My Health Online. And I also support and consult with PCPs in the clinic who has some questions about psychiatric medication or psychiatric condition, and support them that way. And also support the other psychiatric staff and providers and therapists within the clinic. So the good thing about an organization like that is you have a lot of people, providers, supporting you to help the patient that you're taking care of. Hi guys, so right now what I'm doing is going to my clinic for just a few hours. I've been working from home, so that's what I've been doing. And so right now I'm just going to the clinic to check if there's any paperwork I need to do for patients. Usually these paperwork are letters for work or any short-term disability requests or any other refill request that's usually coming in as fax paperwork. So that's what I'm gonna do, and I'm gonna go there for about 2 hours, and it's called admin time. And for those of you who are nurse practitioners starting out, you always have to request for an admin time, because if you don't, then you're going to be piled up with charting, and you're also going to have to then find time to do other things, because seeing patients is not your only role. There's a lot of other things that you need to do in order to be an effective and efficient provider. Okay, so I'll see you in a bit. So my work isn't too far from home, so it's a good thing. Right now it's so hot in California. I think it's 90 something degrees and it's been like this for about a week. So I'm trying to decide whether I want to get some iced coffee before I go to work. Kind of like a little bit of a motivation for me. And I was thinking, should I not? I have been good not being able to get, Starbucks since work from home, but hey, why not? It's very hot right now, so I think I deserve an iced coffee since I had to get out. Okay, so I spent about 2.5 hours at work doing some charting. Actually, I had like maybe about 10 charts open that I haven't completed, and so I was able to complete that all today and catch up on some of my notes, refills, requests, consultations from other providers within the clinic, emails. So that was a good 2.5 hours so that I can actually feel calm and rested now that all of those are done. So that's what I usually do during my admin time, and if there's any voice messages, stuff like that, I also do that. Okay, so why is it important to have an admin time? Like what I said earlier, it's just, if you don't, you're gonna have charts piling up. It would be best if you do your charts during your visits with the patient, and then end the chart as soon as the patient leaves your office. But how possible is that? It's so hard to do that, especially in psychiatry. I think in the medical, family nurse practitioners, it's easier. At least that's what I heard from other colleagues. But for psychiatry, we're doing parts of what we do is therapy, and being able to communicate with the patient. Sorry, that kind of to communicate and empathize and really support the patient. So you want to really do, an eye-to-eye contact, be facing the patient instead of facing your computer. So those are really essential. But so far since I started, I was just charting on a notepad and writing down what patients tell me, and then transcribe it into the electronic health record later on. And guess what? That didn't work out. I ended up with charts open that I have to finish, for many days, and it's not a good thing to have that. One, it's going to be hard for reimbursement. Two, your clinic usually has a policy on how long you can have your chart open before you get, disciplinary action. So you want to make sure that you try to chart as much as you can during your visit with the patient, but of course facing the patient as well, instead of just looking at the computer, because that's not good practice as well. So you want to be still present with your patient. I actually have a friend who's a new nurse practitioner. He might be watching this, and it's hard because sometimes if you're working in a private practice, of course it's a revenue kind of practice, so they want you to see as many patients as you possibly can, and it's just not doable to see more than 12 patients a day, to be able to effectively support the patient, think about the best treatment plan for them. Maybe for someone who's not a novice nurse practitioner, someone who's an expert should be fine, but if they're not, that's not something I really would recommend. I would recommend a practice where you can have, in between patient visits, that you can get supervision, consultation with a mentor within the clinic, or supervision with, a psychiatrist. So I think that is something that you want to find during the time that you're looking for a job. Especially as a new nurse practitioner, because that is one of the biggest things about nurse practitioner is the charting. And if you can't keep up, it's gonna be difficult. And if you can't keep up, it also kind of gets to you later on, because if you haven't charted, you're late for 2 weeks, and then you see the patient within 2 weeks, and you're like, what did I do? What was the treatment plan 2 weeks ago? Then that becomes a problem, right? So you want to be able to get things done the same day as you saw the patient. But things happen, so that's why it's really important to have admin time. To be honest, 10 patients is usually the best balance, because if you think about it, you can spread your 10 patients within an 8-hour period and have at least 30 minutes, 30 minutes in between, and then an hour in between for you to be able to, you know, just keep up with the charting, keep up with other things that you need to do, and also just give you time to process what you did or how the visit went, because sometimes it can be emotionally difficult what patients bring to us, right? And so I think it's really a good balance if you're not seeing patient back to back, like for whole, like today I actually saw seven patients within a 4-hour period, and that's a lot, but it was a 30-minute back to back, but it was all follow-up, so I know the patients, so that made it okay. But if you are starting out, that is a lot, because you're still processing things, you're still, you know, thinking about evaluating a lot of things, whether this is good for the patient and not, and there's a lot of factors that you're thinking about. So I think for someone who's just starting out, every 30 minutes or even less than that for a follow-up would be very, very difficult, and you will burn out. So that's not something I advise that you do. What it looks like in a snapshot, a day in my life. Initial evaluation, that's a little bit more of a longer conversation, so that's not something I'm going to be talking about here today, but that's pretty much what it looks like a day in my life as a psychiatric nurse practitioner. So if you guys learned something from that and you like that video, like this video, please do subscribe. It would help me a lot, and comment or like this video, so I can make more for you guys. Take care. Bye.